I think that we can start with our first session. Thank you so much, Steve, to join us today. We are going to have a great session from Steve Chamberlin from Sensa Analytics. This session is going to be about Plano Orthopedics revenue cycle and machine learning in revenue cycle management processing. And Steve has a huge experience in Oracle. He has more than 20 years of experience with Oracle systems. And he also started his own company. And recently he has the Oracle Excellence Award. So congrats, Steve, for this. And I will let you continue with the introduction, but the audience is all yours.
Yeah,
great.
I wanted to add one fun fact before Steve gets stuck in, and that is he's fostered over 30 huskies, finding them good homes. Actually, I might be interested in talking to you too at some stage. But he's traveled all over. He's only got the Antarctica to go before he's done every continent, and and he's big into healthcare. He's created software for it. His dad sold pharmaceuticals, and his daughter's a doctor. So if you like, he is a human, not just a data scientist. All right. And now with that, I'll shut up and please do carry on. So.
Yeah, no, thank you. Thank you very much. That was one of the things that is really near and dear to our heart as far as the Huskies. So we've been doing that for, over 12 years now. Our oldest girl is about 12 years old. And so it was one of the ways that we're giving back, trying to help find some of the happy homes for some of these dogs. So it's been really rewarding. It's been a lot of fun. Most of them have been puppies. So I don't know how many people know about Huskies, but puppies are very energetic and always wanting to be entertained. So that has been great. So anyway, thanks for that introduction. And I'm really excited to be here today. So like I said, we're going to be talking about machine learning and what we've done in healthcare, mainly for Plano Orthopedics. So this is about Plano Orthopedics, their revenue cycle, and how we've been able to make an impact in that. So we're going to be covering a lot of different topics on what led up to this as well. So not only the introduction, giving you a little bit more background on both our companies, but also why healthcare? What are some of the ways that this is helping to improve not only what the administration of healthcare is, but how this helps doctors? And what are some of those different challenges that they're facing as they're going through this, and why machine learning ends up being perfect technology for being able to apply to this. To explain that process, what we're going to do is we're going to do a high-level review of the data and its workflow through this process, then getting into the nitty-gritty of the machine learning, how we're applying this, and giving you a specific example of one of the what we call scrubs are for the process. And then finally wrapping up with what are the benefits that Plano Orthopedic has actually already realized from the program. They're really excited. The CEO is just has nothing but good things to say. The reason I'm chuckling is one of the things that really made us feel good is, okay, you guys are worth your weight in gold, is one of the quotes that we've been using. But orthopedics, Plano Orthopedics has been around for over 45 years now in the North Texas area. Having patients throughout actually the southern regions as far as the states and actually elsewhere. But for the majority of their patients are coming from this the southern region. And what we're doing is we've been doing a lot of analytics using Oracle's technology. That's what we're most comfortable with, but also gives us huge advantages that we'll cover here in a few minutes in more detail. But it's for the SMB for healthcare. It's just a great solution, and we're going to cover all those different reasons why. But as far as within healthcare and some of these facilities, what we're talking about when we say SMB for healthcare, it is 2 billion and below. So this could be physician practices, mostly physician-owned practices that are 10 physicians and up, but we also are helping out hospital networks that have multiple facilities, multiple EMRs, electronic medical record and health record systems, all within the same organization. Through the acquisitions, just like any kind of company, that they've acquired all of these different data systems, and sometimes it doesn't always make sense to migrate or push everything to one system. And so the only way to be able to do that is have a unified platform. And that's what we have done, is by providing some of these data models to be able to help with some of this growth and acquisition process as they're going through that. As you can imagine, there are thousands of claims from the patients that they're seeing on a daily basis. And that's a constant battle. So being able to manage that efficiently, effectively, when you have a relatively small staff, that can be overwhelming. And then being able to put it into a format that everybody can use. One of the biggest complaints that we always hear is about the reporting from some of these healthcare vendors. What they're mainly focused on for these different systems, like the EMRs that I was mentioning, is, of course, being able to capture what's going on with the patient, helping the doctors, providing better healthcare. And so it makes sense that that's what they're wanting to do, is make that process as easy as possible for the doctors, but then you still have the administration. So trying to keep that as profitable as possible, just like any organization, so that they can continue providing this outstanding care. And so as far as Plano Orthopedic, they're a perfect example. So they're up to 14 physicians. As far as total, as far as the MAs, the medical and physician associates, that they're well over 20 different individuals and a staff of well over 100 just for this one facility. And so they have so many claims that they're actually processing one claim, more than a claim a minute for these different people. So trying to make sure that they know the exact rules for every insurance company, as well as the federal rules for these different types of procedures, an injection versus a surgery versus just an office visit. That's really a challenge when you're looking at all these different ways that they're providing healthcare. So being able to have an automated solution, instead of someone literally going through these on a daily basis and spending hours, if not close to the entire day, to make sure they're in compliance, is a huge value add. Excuse me. So instead of just having the reporting, is being able to apply machine learning to this process. So this is a diagram of what's going on when we're applying these solutions to our healthcare customers. So on the left-hand side, there's multiple different types of data sources, everything from the EMR to the billing systems, practice management systems. Basically, what are the different systems that are submitting these claims? And that's what we're talking about today. But it feeds all this information from these other sources. The diagnosis codes, that's all coming from the EMR, the what we're calling LCDs, but the coverage, that is from PDFs or spreadsheets that have been converted, that have been loaded into tables. So that goes into the Oracle autonomous data warehouse. And we've created some standardized models for some of these different business areas, like billing, physical therapy reporting, so on, and even built on some apps. So as it's going through autonomous, is grabbing some of that information and being able to automate the process, and then finally giving it into reporting based off of the role of what they need to look at. So the CEO, he wants to know how they're doing on a daily basis of getting process claimed and getting those reimbursements. So in that process, what we're talking about is having, just for revenue cycle, that there are 30 plus different tables. And then when you're actually talking about multiple EMR systems, you could actually have layers of each one of those different sets of tables. And that's how you end up with millions of rows of data getting processed on a daily basis. So what we're doing is we're refining that information. That's actually one of the lessons learned, is making sure, of course, as you're putting this information through machine learning, that you understand those data sources and what are the most crucial for that process. So again, just at a high level from a diagram perspective, we're grabbing this information and we're grabbing it right up front, this claims data, before we're putting it into machine learning. So we know what it is that we're looking for based off of these different procedures and what the insurance company is requiring for being processed. This could be a combination of doctor signatures, attached documents for the surgery of the diagnosis, as well as what are all those diagnosis codes and making sure that they're in the right order. And so you have all these rules that have to flow through this process before they're sent over to the clearinghouse for being sent to all of the different insurance companies. And then when they come back again, that's where we're putting it through. And this is our phase 2 process of using machine learning for that to really analyze, find out if there's any denials that we didn't expect, so that we can run that right back into the front end so that they can clean up those claims before they even go out. And then what this means as far as payments is cash flow, getting the money back as quickly as possible, being reimbursed from those different companies. And what this means is getting paid in a couple weeks versus 2 to 6 months. That's how far it can easily slow the process, that if you've gotten anything wrong, it's a minimum of 30 days before you can make that adjustment, send it back in, and hope everything gets processed again to get paid. So it's a huge issue. So to simplify this process, what we did is we created a little demo. So this is for the injection process. So as patients come in, they have hurt their knee, an elbow, shoulder, and so there's different types of procedures that would be applied by the doctor, and different types of injections, of course, that would be used to alleviate the pain and help the healing process. So what we're doing is we're taking all of that information from the diagnosis codes to what's been traded, and then trying to say, okay, did you do it right as far as the coder, or did you break one of the rules? And this needs to be corrected before it gets sent out again. So in that process, so what we're doing is we're jumping into the flow of machine learning for grabbing this. And what you're going to see, I'm going to talk through some of the different particular pieces of that. But right off the bat, what we're doing is we're saying, okay, here's what we're doing with the claim, and here's the different pieces of data that we need. So even before it gets to this point, we have already done some refinement of the data of consolidating. So when I was mentioning before that there's 30 some different tables, we've used some of the statements, SQL statements, so that what we're doing is we're creating stored procedures and views so that we're reconciling some of that information into single transactions to make this process a little bit easier. So as this is flowing into this, what we're doing here, as you can see, we're looking at, in this particular case for our demo, we're just looking at 2 different procedure codes. For injections, what Plano Orthopedics is using is we've created and set up a table and a form so that they can actually monitor and update all the different procedures. And so there's over 20 different procedures that can be applied during this process. And so what we're doing is we're grabbing a couple of these and then just looking at, okay, how often are they accepted or rejected by the insurance companies based off of the different diagnosis codes. So that's why, so we're looking at some of these, and you can see this is a table based off of the visit IDs and being able to see, here's the different values that are coming out of that. So as we're going through this, what we're doing is we're actually using the a priori, association rule for being able to help us with that process. The reason we chose this, and we've gone through several others, but since this was known as far as what are the different procedures, what are the associated different diagnosis codes that we're looking for, and those specific rules, this is the one that we chose that looks like it's been providing us the best results. We've also been going through and adjusting the different support, the different confidence. Here, if everybody can see this, the confidence is set at 0.1. We've raised this to 0.75 or 0.8, I believe, for being able to look at some of the different confidence. And this is some of the when we're doing a live demo, if anybody's interested. So what we're doing is we actually adjust those to find what's the best results that we get from those transactions of looking at the procedure codes and the diagnosis codes, so that we're getting the best results. And when we're talking about the results, that's something else we're going to talk about a little bit later. And so I think right here is a good point to bring this up as far as the data scientist versus the end users that are going to be using this. So from a data scientist, we're very fortunate to have a mathematician with a degree from one of the advanced physics schools in the country, UCSB, that has helped us put together these models and go through and do this testing and figure out, okay, what's the best algorithm and the best coefficients for getting out the results. So that is one side of this, is being able to know and go through an iterative process for being able to know the results and looking at those different scores that we'll be talking about in a minute. But what I wanted to touch on as far as a quick tangent is that's all good, that's all great, but without knowing what the end result is for those users, and what they're looking for is just a yes or no. What's right, what's wrong, why is it wrong, and what do I need to do to fix that? So all of these scores are great from a data scientist perspective. They go way over their heads, get glazed eyes when we try to talk about any of that information. So knowing your audience is so crucial through this process, that it's basically a project success factor that we've learned. So the first time we did this with another healthcare organization, we went way too low level detail. It was too much for everybody to try to understand. It took twice as long to get through the project, and it took longer for us to get the right results for those individuals. So anyway, that's a side tangent for lessons learned, but back to the machine learning side of this. This is where the algorithm has become a great tool for us, is because it's able to go through all this different information. And so you can see here some of the different settings that we've been using for scoring the results out of this process. And so what we've been looking for, and so the reason that we're using the result of 3 is just because in this particular demo, what we're looking at is just a couple of the different procedure codes that I was showing before, and then being able to look at just, is it accepted or rejected? So keeping it nice and simple so that as we're going through and now feeding some of this data through the process, now we're getting into what are some of the different numbers of items of that 1 through 3, and what are the different scores of those accepted transactions based off of the diagnosis code. So here you can see this is where we are looking at that procedure code that you saw up front as far as the 20553 and 20552, and then the different diagnosis codes. So a diagnosis code can mean, was this the left arm, the right arm, or both? And the same thing for knees and such. So depending on how that's being applied, that will have an impact on the procedure code. The other impact that this has that we'll go through in a minute is also the modifier. So with each procedure code, there's a modifier that goes into this as well. So that's why with pulling machine learning, as you can see here, we're looking at what are the different confidence factors. How confident are we that we're actually going to get the right result as we're going through this? So as we're processing this data, just being able to say, is this in the right order? Do we have the right procedure code associated with the different diagnosis codes? And then being able to use that information into our reporting. Now, we're not going to, what you're going to see is we're not using these specific codes into the report. That's also part of our process, is that we're translating this into values to say, just to simply yes or no. Is this going to get processed correctly? Or do you need to look at this further so that you can make a correction, make a determination? Was this done right? Was this coded right? Or do you need to do something differently? And so as we go through those different rules and get these different results out, that's where it starts getting applied into the analytics side. And so that's where, again, with it being all within one tool set, it's been super helpful, because then we can immediately go through and build out these tangents, so that what we are doing is we're putting together alerts, warnings, to be able to say, is there an issue with this or not? As we mentioned, that this is one of the scrubs that we're doing of the data before it's sent out. We're up to 12, and we have more on the plate, in addition to the phase 2 that I was talking about, that's pulling using machine learning on the back end. And then being able to summarize and prioritize this, and I'll show you exactly what I mean by that, is one of the byproducts as we were going through and putting this together is being able to say, okay, what are all of the different areas that we want to focus on? So working with the CEO, the compliance officer of Plano Orthopedics, and saying, okay, what are the top issues? So what's costing us the most time and or money as far as being able to make sure that things are done correctly? The other thing that's a benefit that we'll talk about in a minute is just there's only a limited amount of time for the compliance officer to be able to go through and look at these. So a byproduct of this is our little project list that I'm showing here that actually became their checklist. So a daily checklist that would actually go through and link them directly to what they need to do to check all of these different items. In the future, what we're going to do is have a dashboard that would consolidate this all into one place, so the CEO, the managers can actually see, okay, how are we doing overall in each one of these areas? But the main focus of machine learning and being able to get this out is to make the team more efficient. So this actually gave them a checklist to be able to say, okay, for multiple office visits, so OV means office visit, did we do that one right? And then down the list on through to what we're talking about is the injections, which was called a combo. That was number 8 on the list, and making sure that, again, that had the right modifiers. So what that turns into is, this is an example of one of the dashboards that they use that is interactive. And again, you can see we're not displaying the information out of machine learning, though it is valuable. We're translating this into these counts. How many counts are there in the different confidence levels, and color coding it. On the very left-hand side, what they're doing is they're going through, they being Plano Orthopedics. So the revenue cycle department, the coders and the manager, they're going through and writing out new procedures and including it right on the Oracle dashboard, so that what they can do is be able to see what they need, what actions they need to do, and how to interact with this. So again, being able to take this from a senior person that's been doing this also for 20 plus years, of understanding how claims work with insurance companies and the government, and being able to process that. With that being said, what they're trying to do is have others that don't know it as well, being able to work through that and process that accordingly, efficiently. The other aspect that we have already started working into this is not only of the alerts, but prescriptive messaging. So one is having a prescriptive message, and sorry, I don't have it here, but being able to say for this particular code, for this confidence level, what is most likely the next step that you need to take. And so again, keeping that relatively simple, so that what we're trying to do is just have 3 different versions of what they should look at, and being able to have that right on there, so that as they're going through this, that what they would do is right mouse click on one of these visits, one of these patients, allow a selection to go to the next detail that would give them the patient information. What was the diagnosis code, and then what's that prescriptive message of what that action is. And so that's something that's really obviously kind of sensitive, and is what's called HIPAA compliance, the patient data that needs to be secure. So that's another reason why we don't show too much during this process, just to make sure that we're keeping all the patient's data very secure. But that's what is happening. So from machine learning, being able to take this, apply the confidence level, and then with that score, being able to say what is that prescriptive or next step that they need to be able to take from this. So bringing this back around to what those challenges were that we were talking about in the beginning, is what the improvements are that they were able to get out of this. So this is reducing coding errors. So this is huge as far as being able to make everybody more productive, the managers of being able to do this, and the workflow for providing this. The reason why I'm smiling and just about ready to chuckle about this is because we were just talking about this again with the compliance officer, that she's so excited by being able to have these reports that she's now not having to spend hours going through to make sure they haven't missed something, and can literally spend her time elsewhere and wanting to do more with Oracle, with the analytics, and having ideas on what we can do to also show more so that they can be more efficient. So she also sees this as not a threat to her role, that, okay, now that you have machine learning, you don't need her anymore, or some of these other senior resources, is that they are actually able to focus on other areas of being able to provide healthcare. Because what this does is this literally translates into showing the doctors what's going on with the organization as well as their individual practices. How are they doing as far as contributing to the organization? So now they don't have to spend as much time going through all of that on a weekly basis. They're able to spend that time now on the patients. So they're providing better healthcare. That's what they want. That's why they're doing this, is as these individual practices is trying to set themselves apart and wanting to be able to spend more time with patients because of the way the industry is changing. It just makes it hard to do that. By being able to use these tools, this is where you're starting to apply some of that. And we'll talk about some of those ROI here in the next slide. But as far as automating that workflow, now when they were literally putting this into spreadsheets and emails of sending this around of who needs to do what, now this is in one place where people have a checklist and they know what to do on a daily basis. So it's made everything much more efficient. It's also helped with the forecasting to be able to know, okay, how well are they doing with the business, and what does this mean for the next 3 months as far as what that cash flow is going to look like, because they're able to know much more accurately how well the claims are going to get processed. And then, of course, just the data quality. This is another byproduct of this process, is that we found several different issues with how some of it was coded right from the very front end, meaning the doctors, the PAs, the MAs, of how they were putting the information into the electronic health record systems, which then, of course, is pulled over automatically into practice management and billing for getting that sent out. By making those also more efficient upfront, more accurate, that translates to better claims and a better process as well. So as far as finishing this up, as far as what are some of the different benefits to this process and what this means, from our perspective, Oracle Autonomous has been nirvana. It's just really been great, not only for the reasons that I've already mentioned, as far as having a lot of these tools in one place. So Apex that we're using for the apps, machine learning, of course, that we're talking about today, most importantly, is all delivered within the Oracle database. So we don't have to jump around to multiple places, all managed from one location. The access is then easier, grabbing the data, being able to push it back and forth is a lot easier. The other thing about Autonomous, especially when we're talking about SMBs and healthcare, they don't have a lot of IT resources. In some of the cases, some of the organizations that we work with, they have one or it's fully outsourced. And so having people versed on being a DBA is just not possible. So we would have had to, and which we have for some of the different organizations, different projects, but we would have to hire DBAs, and of course, making the costs go up. So by having machine learning in one place, our data scientists can work everything. They understand the database, the data warehouse, our data models, and that it's all right there. On OML itself, there is a huge plethora of tools. The reason I'm chuckling is just because there's so many different options and so many different ways to be able to use that. That's why I'm being coached by our data scientists on how some of these different things work and what they're even doing with this. So when we're going through and doing reviews, it's very helpful, but it's also where they're explaining why we're choosing some of these different things as they do. But what this translates to for Plano Orthopedic is huge. If the CEO, like I said, he's said that we're worth our weight in gold. Some people that were really skeptical about the project up front are now really stating how well that they love it and what it's done for their jobs, as well as we found actually well over $600,000 of revenue now that Plano Orthopedic would have not had processed because of the combination of machine learning and analytics. So this is more than paid for the project of being able to set this up. And just like every other industry, it's getting harder and harder to try to find people to help in revenue cycle. So rather than having a lot of these senior people, and if they're going to retire, whatever the case may be, that now they don't have to worry about it. Everything is not only documented, but it's actually automated. So the CEO is loving it from that fact of not having to worry about what's going to happen if this person or that person ends up retiring, moving on, whatever the case may be. Now they have a tool set that makes that process a lot easier for them. Another smile and chuckle is the CEO has actually been jumping in there and doing some of his own reports, and some things that would have taken him hours to do in the past, as far as some of this, the margin analysis, some reports for audits, things that literally would take him hours or spending the weekend to do. He's now able to do in a matter of minutes now that the data is there and automated so that he can get his reports out when he needs them. So it's really been a super, super project. They're definitely an advocate. They're happy to take calls if you want to learn more. But it's just been a really good experience for everybody. So I guess that's just to close this out, and Roger or Edelweiss, just want to open it up for questions, or if there's anything else that you'd like us to cover about what we've done today.
Well, that was amazing presentation. Thank you for all the details that you have shared. We know that you cannot share, much more details because of the privacy of the data, basically, right? But one thing that I would like to ask our attendees, if they have any question, please submit your questions in the Q&A box instead of the chat box. And also, I would like to that if you can summarize all the Oracle products that you're using here. Obviously, you're using Oracle Autonomous Data Warehouse and Oracle Machine Learning that is included in Autonomous. But for data visualization, for example, are you using Data Visualization Desktop, OAC, or what is what you're using?
Yeah, good question. So what we're using is, like you're mentioning, so it starts out with the Autonomous Data Warehouse. We're also using Apex. That's what we put together for 4 different apps now that we've created, actually 5 now, for everything from patient registration through to this automation of revenue cycle and how to have the different priorities of what they need to focus on. Machine learning, of course, that we were talking about today, and then Oracle Analytics, both the classic, if you will, the dashboards. So we have claims analysis dashboards that summarizes everything to make it a little bit easier. But then we probably, I'd say at least 80% of what we do these days is using Data Visualizer. So it's a much more discovery tool, of course, to allow them to drill into this data to understand, okay, why did something happen, not just what. So those are the primary tools that we're using.
Perfect. I have a question that someone asked, what company is Steve with? Sensa Analytics is, right, Steve?
Yeah, exactly. That's who we are. So we've been working with Oracle for a little over 6 years now. And we've been doing probably about 80% of the work that we do is healthcare.
Awesome. Thank you.
But do you ever get to work with your daughter?
No, not yet. That's one of the things that is really kind of funny. She's actually been a doctor now just about 3 years. And she's actually an optometrist. So it's not quite the same thing, but it's really rewarding to see what she's doing. And it's really funny because she says the same things as far as the scheduling of patients through to claims processing and the question that she gets asked about procedures. So it's really kind of funny is that no matter what it is, it seems like it's very similar.
Similar method.
You will find you can find a way to do something together for sure.
Probably.
Perfect. Thank you so much, Steve, for this great presentation. And